Welcome you all back for the part 2 on BioBoost, where we'll discuss on enhancing the implant integration with the photobiomodulation therapy. So hope you're clear with the basis of the photobiomodulation with the previous lecture. We'll continue with that with the second part today. So where the PBM, it can be utilized in case of a dental implants. So the science of dental implantology has been evolved over the centuries to produce the most successful as well as with the predictable tooth replacement technology ever compared to the removable prosthodontics. So PBM, it can be utilized right from pre-conditioning with the implant osteotomy site till peri-implantitis stage. So right from initiation to post-implant care, pre-surgical phase, that is from diagnosis, planning or softening with the tissue condition in order to prepare with an ideal soft tissue bed and manage with the aesthetic zones. So even before the surgery with the gingival depigmentation, frenectomy and biopsy, compared to the conventional protocol, the laser, it is going to be less minimally invasive, less patient post-operative discomfort, less bleeding, and more successful predictable outcome can be expected. So PBMT for implant side with 660 to 800 nanometers with a dosage of 0.5 to 1 joule. Check with the parameters. Very minimal in order to have a simulation effect to precondition with the bone. Whereas to the post-implant during the surgical phase, that is, it helps with the assessing, modification and sculpting not only with the soft tissue as well as with the hard tissue with the bloodless precision. So these are the procedures where we can utilize with the PBM therapy. Followed by that, during the prosthetic phase, in order to sculpt, scale and as well as to stabilize with the peri-implant mucosa, the photobiomodulation, the laser, it can be used in much better way. So even at the maintenance phase for the healing, peri-implantitis prevention or the treatment, it can be utilized with the photobiomodulation. So you got to know that is from the initiation, even before that, to the post-implant stage, post-healing also, the PBM therapy can be successfully integrated with the conventional therapy. I'm not saying it is going to replace with the conventional treatment modality, but definitely it's definitely going to be an alternative as well as an assisted, laser assisted or PBM assisted treatment modality for sure. So apart from this, it's going to expand further to soft tissue leveling prior for the multiple implants, laser assisted sinus lift. It's going to reduce with the time. It is going to reduce with the post-operative discomfort. It is going to enhance with your patient healing. So the outcome is going to be much better with the laser time. We are all working in this world fast era. We are moving on very fast with the CAD-CAM technology rather than the impression. In that way, the PBM, it is going to definitely be helpful. Flapless surgery, soft tissue tunnelization, faster turnover in case of multiple stage surgeries with the help of PBMs. Yes. What are the potential complications we can expect from the dental implant treatment as such? Because implant rehabilitation considered as a worldwide accepted treatment. Thousands of implants has been placed by the general practitioners and specialists, but fewer complications it will arise, right? So 10% or more than that, it could relate within slow healing complications, infections, tissue damage, inadequate blood supply, and the deficient blood supply on optimal healing process because of the altered oxygen level to the, it's most commonly you can see in a medically compromised patient, especially with the diabetes patients. Other medical conditions may lead to alveolar bone resorption even after the tooth extraction. So all this could be possible potential complications we can expect in an implant patient where the PBM, it can help with it, right? So the following protocols, whatever I'm going to decide, it's obtained from the literature and the parameter has been set based on the clinician's clinical judgment. I'm not saying it is a universal one, but definitely it's been opted for that patient and for the protocol really worked up. So socket preservation, the effect of PBM on bone healing for management of socket preservation. So when interacting with the laser light and the osteoblast, it is going to be a trend in preserving with the socket bone. So it is going to affect with the key cellular forms and thereby triggers and there it will helpful in the healing process. When irradiated with using the appropriate parameters, it could improve with the osteoproliferation and osteoinduction for socket preservation, not only in the healthy patient, as well as it is going to enhance even in the medically compromised patients. And it has been a proven study where they have done along with the presence with and without an allograft of an biomaterial, where PBM irradiated group showed a much better results. Here it's going to interact within the cell and around the cell, and thereby it is going to alter the repaired, a stressed cell into a repaired form by enhancing with its ATP production, enhancing with reducing with an inflammation condition. All this potentially it enhances with the growth. So PBM aided post incision. So right from the mid crestal incision with the laser, it is going to be much better. The tissue punch with the laser, it is going to be bloodless, quick healing, and no sutures with the minimal discomfort. And laser troughing, it allows with the soft tissue shaping, aesthetic control. So all this, even at the implant prosthetic stage, it will be really useful. On the very same day, you can make with an impression and give the crown to the patient because of minimal bleeding because of the laser usage or PBM. Laser assisted flapless with the repositioning. It helps in maintaining the keratinized, the very vital tissues in order to maintain within peri-implant health. It helps with that minimal flap reflection, and most importantly, a better aesthetic can be expected when we are going to do it with the laser. A pain reduction, it will significantly reduce because it is going to modify the nociceptors which are responsible for the pain perception. That's how it is going to reduce with the pain, and it reduces the inflammation because it is going to interact with the inflammatory markers, and thereby it is going to mask and reduce with the pain, and which has been measured on the visual analog scale. Patient reported with a reduced discomfort in the laser group compared with the punch method. So other findings, faster healing, which is very important, minimal bleeding and swelling reported, and slightly and improved early aesthetic outcomes. Kindly note down this word early. So everything in early, we are going to enhance with the healing, right? We know these are the future complications. Why not? We can try on the surgical phase or pre-surgical phase. So no flap, no bleed, just with the laser speed for comfort and healing. It's all we need today. So the sutureless close with the minimized bleeding, faster healing, improved aesthetics, and patient outcome. So in order to simulate with an osteoblastic activity, and this was the protocol suggested by Dr. Gary Ross, Dr. Arun, and Rita Darbar from GMA Laser Academy, where 8 joules to bone before suturing, 2 joules overlapping along with the path of the suturing, and ideally repeat this process for 2 weeks in order to encourage with the connective tissue and with the bone remodeling process. And less pain, you can expect faster and better integration. So applying the 8 joules overall into an implant site in bone after implants has been prepared, and repeat this 2 weeks, 4 joules per centimeter square on the buccal as well as on the lingual aspect. Faster and better integration with the stimulation of osteoblast and fibroblast will happen. So use a laser to soft tissue over implant, a diode or an erbium laser. Apply with the PBMT. It is going to enhance with the healing, and preferably the PBM will be given on the non-contact mode, that is away from the tissue. How much away? Again, it is going to be an study where I did a study with the different irradiation distance. As long as you close with the tissue side but directly not onto the tissue, will do the justification with enhanced healing. It varies condition to condition and need to need, right? So apply PBM immediately after the exposure. It's going to enhance with vascularization, soft tissue regeneration, and faster epithelial. This is a conventional laser used in order to remove with the tissue covering the implant site, and post this you can give with the PBM. It is going to enhance with the soft tissue coverage in future. The overgrowth, everything can be minimized. So expected soft tissue can be arise. So when to give with PBM? Before the placement or after the placement? So before placement, we are going to give it to simulate with the angiogenesis and reduce with the inflammation. The reason for giving the PBM again after placing an implant, to enhance with the soft tissue healing and reduce with the post-operative discomfort. This is the suggested protocol based on the literature for PBM in related to the implant placement. So let it be in single or in multiple implants, the It is going to provide with a better aesthetics, better healing, and optimal emergence. And it is going to be really beneficial in case of a multiple as well as in the anterior region, right? So the key findings from Baldrini et al., where he did a study with 64 Vista rats, suggested that low-level laser-treated implants had a higher torque values at 30 and 45 days compared to the control. A single LLT provided a better integration. And again, with the poor implants, I mean, with the poor bone, without any initial stability, in those cases also, LLT promoted with an osseointegration. And this is my own study where I did in a medically compromised condition called diabetes. With and without PBM, it has been given to the patient with an overall energy density of 8.3 joules per centimeter square, covering all the aspects. It definitely improved with the integration, not to the maximum level because of the optimal tissue condition and the patient condition. I've achieved a much better results compared to a conventional protocol, and a significant reduction in the post-operative swelling and healing was better, and soft tissue healing was really good with the PBM therapy. Due to many benefits with the PBM, it has a positive biostimulatory effects on bone regeneration. It accelerated, but there is a lack of standardizing these protocols, which is where we need to concentrate really. Enhanced with the dental implantability, but standardized protocols and further studies are needed. Again, it was proposed by Zayed et al., which is in a recent systematic review done in the year of 2020. PBMT and bovine bone reconstruction. Even in the bovine bone graft used reconstructive surgery, PBMT done with the justice, and it has a potential to improve with the bone reconstructive process. It is going to accelerate. It is one step ahead when compared to the conventional one. And peri-implant complications, right from mucositis and peri-implantitis, the current data suggests a higher incidence than the earlier believed as a cause of an implant failures, even 20% or more than that. So this is one of the interesting article I read from ITI forum, where they done and gave a protocol how to be followed in case of an PBM assisted or a laser assisted peri-implantitis management. And this is going to be beyond the scope of this panel as an advanced modality. So I'm giving a short review on how the peri-implantitis it's going to be helpful. So you can look out the video. So the lower level laser with 600 to 1000, diode laser with 800 and 980, it is an effective for an antimicrobial action as well as the tissue healing with peri-implantitis condition. And erbium YAG laser used for the implant surface decontamination. Implantoplasty, it is not suggested with the laser, but definitely you have to keep the laser tip away from the tissue, and the sharpening points can be smoothened in order to prevent with the microbial adherence. So these are the fewer clinical tips which can be assessed. Non-contact sweeping motion, the laser beam, it should be either parallel or tangential, never to be on perpendicular. So the constant motion of this laser tips, it will reduce in accumulating the hotspots at one area, and which might affect with the tissue or the implant surface. So it's always in a constant motion. So apart from this, along with a combined high-level laser therapy, the PBMT combined therapy also, they are doing it recently in order to accelerate with the bone healing as well as in the socket preservation condition, and it showed a significantly a strong suggestion to use with it. Though there are a lot of in vitro and in vivo in an animal study is there, we need to consider with comparing this into a clinical study with different types of fluid sources in order to standardize with an optimized protocol. The better integration can be expected with the photobiomodulation therapy. As I said, it is not going to be a complete alternative solution, but it is definitely an adjunct. And thank you one and all. And these are the fewer publications I did related to the low-level laser therapy. Thank you.